Hello, my name is Betty. I'll be presenting about Vargas disease. So this 40-year-old white male came into the clinic complaining of pain in his legs for the last 2 months, and he mentioned that the pain get worse when he's walking, but when he's resting, he doesn't have any pain. He also complained of numbness and tingling on his feet and hands for the last 2 months. And his hands tends to be pale when he's anxious or when it's pretty cold. He works. He's married and have 3 children, and he works here in Lexington as an accountant. He also mentioned that he usually takes naproxen to help with the pain, but for the last few months he stopped taking the naproxen because of the ulcers he developed. His vital signs are good, except his blood pressure is a little bit high. Um, he's not currently on any medication. He's a smoker. He's been smoking 2 packs of cigarettes since he was 21 years old. He has history of hypertension, anxiety, and he hasn't had any surgeries. His father has hypertension, and he's also type 2 diabetic. His mom has hypertension. The fuel system, he denies any headache, any eye problems or discharges. He doesn't have hearing issues. Um, he reports no sinus or runny nose in the past few months. He doesn't have any difficulty swallowing. No dental or gum issues. He denies palpitations, tachycardia, or any easy bruising. He reports mild edema in the affected toes. He also has 1+ pedal pulses bilaterally in both feet. GU, he reports no nausea or constipation. GI, he doesn't have any dysuria, nocturia, hematuria, or any flank pain. Skin, this guy present to the clinic with foot ulcers. So he's got foot ulcers in his in his feet, and his skin is a little bit pale with blue tinted hands and feet. He's allowed an oriented times 3, and he reports numbness and tingling in his fingers and toes for the last 2 months. He denies any muscle weakness, reports pain when he is ambulating, but no pain when he's at rest. He denies any current feeling of depression, anxiety, or any thought of suicide. So, Vargas disease is a rare disease of arteries and veins in both upper and lower extremities. It's always associated with smoking, and it tends to happen for people who are smokers and 45 years old or younger. So what happens is the blood vessels become inflamed, swells, and become blocked by blood clots, which because of the blood flow problem, it can destroy the tissues, which can also lead to infection. So signs and symptoms for Vargas disease is tingling and numbness in the hands and feet, which the patient presented with that. Also, these patients tend to have a pale, reddish or blue tinted hands and feet, and painful open sores in the fingers and toes, which of course this patient presented with all that. Also, these patients tend to have pain that comes and goes on the feet, in the extremities, and the pain seems to go away when they are at rest. The fingers and toes tend to turn pale when they're exposed to cold, which this patient had that. What are the risk factors? Cigarette smoking and cigarette smoking increases the risk of having Buerger's disease. Also, if you have a chronic gum disease, it's more common in male than in female. And also, it's also common in people who are 45 years old and younger. There's no definitive diagnosis for Buerger's disease, but it's just a matter of ruling out other diseases that have the same symptoms like Buerger's disease. So one of the tests that they will do is the blood test to rule out other diseases that have the same symptoms. Also, they do Allen test to check the blood flow in the patient's hands. So what they do, the doctor asks the patient to make a fist, and then they'll press on one of the arteries, and then ask the patient to open the arms, the hands, and to see how fast the blood flows. To see how the blood flow is slow or fast. And most of the time, people with Buerger's disease, when they open their hands, the blood flow doesn't occur quickly. Also, they do angiogram, which is so that they will look at the condition of the arteries if there's any blockage. And I was looking at the Hopkins website. They say when they do the angiogram, they usually see a classic corkscrew appearance in the arteries, which shows there's some blockage. So MC, my patient, was diagnosed with Buerger's disease based on the symptoms, and he had a positive Allen's test, and the angiogram showed that he had the classic corkscrew appearance in the arteries. What's the treatment? So currently there's no treatment for Buerger's disease. The only way to slow the progression of the disease is to stop smoking, or like any tobacco, you're not supposed to use them. Medication, sometimes they prescribe medication, vasodilators, to vasodilate the vessels that are affected to increase the blood flow. Also, intermittent compression of the arms and legs to increase the blood flow to the extremities. It's also been done. Also, most of these people, if the feet or the hands are really affected, they get infection, and some of them have gangrene, and most of them will end up with amputations. So my patient, he was advised not to stop smoking, and he was prescribed vasodilators. Discharge teachings. So my patient was advised to check the skin on the arms and legs daily for cuts and scrapes. Also, patient outcome. Um, so, um, when my patient got the diagnosis, he was really upset because he kept blaming himself, saying that, I wish I knew this. I can, it's a possibility that I can get this kind of disease. Um, but he was willing to stop smoking, to try to stop smoking to slow down the progression of the disease. Also, based on the disease and treatment available for the Vargas disease, um, the patient that I had agreed to join smoke cessation um, support group here in town, um, which was good. I've never had a patient with this disease before. Um, I really felt sorry for him because there is no cure. But I was happy because he agreed to stop smoking. Also, when I'm doing patient teaching nowadays, after my past experience with that patient, um, I encourage patients not only to stop smoking, but I also like teach them like different um, diseases that are associated with smoking, because most of the time we only tell people like, you're going to have lung problems, but we don't tell them also that there's other problems that are associated with smoking, such as the Vargas syndrome, Vargas disease. Those are my reference. Thank you.